Ologists, breaking through the code of doctor terminology. Can't tell the difference between a podiatrist and a pediatrician, or a general practitioner and an emergency physician? Welcome to Laddercat Productions. We know doctor terms can be extremely confusing. But stick around, because in this video, we are finally breaking through that doctor terminology code. 1. Pediatrician. In case you don't already know, pediatricians are the doctors who take care of the babies and the kids. But fun fact, did you know that you need to switch doctors only by the time you turn 21? All the years before you do, you will have to consult the same doctor as the cute little babies for any kind of boo-boo. 2. Podiatrists. Podiatrists are actually the doctors who specialize on all things involving the lower limbs and feet. They're usually in charge of treating and managing pain and diseases connected to these body parts. 3. Endocrinologists. Endocrinologists are the doctors who specialize in all types of glands, as well as all the types of hormones that these glands produce. Usually, these doctors treat those who have thyroid dysfunction, diabetes, and other related diseases. 4. Neurologists. Neurologists are commonly known as the brain doctors, but what they really do is that they focus on the functions and anatomy of the nerves and the nervous system and treat disorders relating to them. 5. Rheumatologists. Rheumatologists specialize in the treatment of joints, muscles, and bone problems. They're different from the orthopedists in that, while the orthopedists focus more on the injuries and areas of pain, rheumatologists focus on the body's overall health and movement. 6. Orthopedists. Now that we've mentioned it, orthopedists are the doctors who specialize in diagnosing and treating problems related to muscles and the musculoskeletal system in general. Patients with injuries such as torn ligaments and broken bones usually turn to these doctors for treatment. 7. Immunologists. Also called allergists, these doctors specialize in treating asthma and other diseases of the immune system, including allergies. 8. Psychiatrists. Psychiatrists are not psychologists. Although it can be argued that they perform pretty much similar functions, psychiatrists are actual trained medical doctors who specialize in treating mental health problems, while psychologists, on the other hand, are professionals trained to observe human behavior and its conditions. 9. Nephrologists. Nephrologists are doctors who specialize in treating diseases of the kidneys, including kidney failure and other chronic conditions of the kidneys. 10. OBGYN. Also called obstetrician-gynecologists, these doctors specialize not only in pregnancy and childbirth in women, but also in diseases that affect the female reproductive system. 11. Pulmonologists. Pulmonologists are the doctors who specialize on respiratory organs such as the lungs, the airway, as well as the respiratory muscles. 12. Surgeons. Surgeons perform, surgery on people. Usually, these doctors work with other doctors to help physically address diseases or conditions that can no longer be treated by just mere medications. 13. Emergency physicians. These are the trained doctors who treat patients undergoing medical emergencies, mostly in hospitals' emergency rooms. 14. Ophthalmologists. Ophthalmologists are eye doctors who are trained to diagnose and treat all medical problems relating to the human eyes. 15. Oncologists. Oncologists are the doctors who specialize in the prevention, diagnosis, and treatment of all kinds of cancer. 16. Urologists. Urologists are not just the male equivalent of gynecologists. They also specialize in the function and treatment of the entire urinary system. 17. Otolaryngologist. This term sounds a lot more complicated than it actually is. Otolaryngologists are actually the doctors commonly referred to as the ENTs, or the ear, nose, and throat specialists. 18. Anesthesiologists are the doctors who usually put you to sleep before a surgery. They are in charge of overseeing pain medications as well as administering them to patients. 19. Dermatologists are the doctors who specialize in anything about the skin, which can include conditions as simple as a small acne to more severe ones such as psoriasis and cancer. 20. Radiologists. Radiologists are the doctors behind the diagnosis on some of your lab works such as X-rays, CT scans, MRIs, and others. 21. Gastroenterologist. These are the doctors who specialize in looking after the liver and the gastrointestinal tract in general. 22. Cardiologists. Cardiologists are the heart doctors. They specialize in diagnosing and treating problems involving the heart and the blood vessels. 23. General practitioners. Sometimes called GPs, general practitioners are doctors normally trained as primary care physicians and are usually the first stop when a patient has fallen ill. Did this video help clear up any confusion for you? Make sure to tell us in the comments and don't forget to like and subscribe. See you next time!